Welcome everybody to day 2 of the 2013 AgrAbility Virtual National Training Workshop. We're glad to see so many people joining us this morning. Our presentation is on health insurance, you and health insurance, specifically focusing on the Affordable Care Act. And our presenter this morning is Professor Roberta Rupertella, who is currently at Kansas State University, and will be sharing a little bit more information about her in just a minute. Before we actually start with the presentation, we will go through our instructions for those that have not participated in our webinars before. You do need speakers or headphones. We are not using a phone connection for this webinar. You can adjust your connection speed through the meeting menu up at the top left and the Manage My Settings menu. If you have any questions about the content of the presentation, you may type those questions into the chat window at any point and simply hit the return icon to the right of the box there. Also, if you have a web microphone and you would like to ask a question verbally at the end of the presentation during the question and answer period, you may use the raise hand icon that is at the top of your menu bar at the top of your screen, and we will attempt to activate your microphone so that you can ask that question verbally. We will do our 4 poll questions at the end, as usual, and we are also archiving this recording on the AgrAbility website, so we will make that available to you, and we will restate that link for you at the end. If you have any technical problems with the presentation, try to use the chat window first. If you are not able to use the chat window, for example, if your screen is locked up and you can't do anything, just email us through the agrability@agrability.org email address, and we will monitor that during the presentation. Some of the issues we've had in the past, though not this conference, thankfully. Echo, that can be caused by being logged in more than once. So your remedy is to simply log out for at least one of those times that you're logged in. If we are disconnected with our presenter, please just hang on and we will reconnect as soon as possible. And if you are disconnected as a participant, please log in again. For those on the webinar today that may not be familiar with our program, AgrAbility is sponsored by the U.S. Department of Agriculture, and we focus on issues of disability in agriculture. We partner land-grant universities with nonprofit disability organizations, and there are currently 20 funded state projects around the country, and those cover 22 different states, as we have one regional project. There is one National AgrAbility project, and again, that's led through our Breaking New Ground Resource Center here at Purdue, and we have several partners on that project, including Goodwill of the Finger Lakes, the Arthritis Foundation out of Indianapolis, and our evaluation team from the University of Illinois and Colorado State University. So if you have not checked out the agrability.org website, please do that. There's a wealth of information there regarding disability in agriculture. So at this time, I'd like to turn things over to Professor Rupertella. She is the Kansas Health Foundation Professor of Community Health at Kansas State and part of the Extension service out there. She's also an Emerita Professor from the University of Wisconsin-Madison. Contact information, as you can see, is on the screen there. So I will disconnect my camera and microphone and allow her to go ahead and turn hers on, and then I will be back at the end for our question and
Thank you, Paul. Can I be heard?
Sounds good.
Good. All right. Good morning to you from surprisingly chilly Manhattan, Kansas. I thought when I left Wisconsin I was going to have weather that was a little bit warmer. It supposedly feels like 1 degree out there, so I guess I'm grateful for the degree. I want to thank Paul and the rest of the team for inviting me to talk with you. I am an extension specialist at K-State right now, and we as an organization, as an educational institution, have been very involved with thinking about what the Affordable Care Act means and what role and responsibility extension has with it, so that I and others have been developing educational programs, and this is one of them. Usually we do it for, we usually work directly with consumers. I have been doing a lot of education of my extension colleagues throughout the country and throughout Kansas for the states. We're asking you to do a pre-assessment so that I get a sense of where people were before they started, and we're going to do a post-assessment so we get an idea of where people are after the presentation. So if you'll take a minute to give some time to this question, whether or not you're a farmer, all of us are consumers and have to make individual choices for ourselves and our families. And I'm just curious to know whether or not people have any understanding of the Affordable Care Act. So I'll give you a chance to vote in on that. And it looks like there may be at least one person who knows a lot. The rest of you think that you know something about it, which is good and not totally surprising. Maybe I'll tell you some things about it that you thought you knew and now you'll know it differently. I know I'm forever learning new things. Okay, what about understanding it as an employer of a farm? Do you understand the responsibilities of the farm itself and the owners of the farms? And if you can answer that question. Okay. That's looking to be less of an understanding than the Affordable Care Act in general for consumers. All right, let's move on. So, again, what I'm doing now is taking a curriculum that I developed with my colleague Barbara O'Neill at Rutgers and presenting it to you. It is called Smart Choice Health Insurance. There's another piece of this that actually deals with health insurance literacy, because some of this is just making people understand what the health law is, what their roles and responsibilities are in it, and some of it is, well, now that you have to choose health insurance, how do you choose it? So the Smart Choice curriculum actually has a piece of it which talks about how people make choices for health insurance. As far as farm families go and health care, there are really two impacts on those families. One of them is as consumers, who themselves will be making health care decisions for their families, and the other is as employers of farm workers. So there you could have migrant farm workers, those who travel frequently between job sites. You may have seasonal farm workers and a local temporary labor force, or year-round farm workers. And it will affect you differently, or affect you in both ways, both as you as the individual family member and you as an employer of farm workers. The Affordable Care Act is really bringing a whole slew of comprehensive changes to the health care, insurance, and delivery systems. It's changing rules and fundings for health insurance. The basic goal here was to try to decrease the number of uninsured. It includes incentives for preventive and wellness programs. It provides money to improve access to providers. It is expecting to lower health care costs overall. It's going to affect all population groups and communities. But more importantly for this talk and what we're thinking about in terms of health insurance itself, it leaves the current private insurance marketplace in place. I just did that overview to let you understand that it's really a very comprehensive law that's set to change a lot of things about our healthcare delivery system. It's not just about the insurance part, though certainly that's really where all of the media focus has been. You may already know this, that farmers and ranchers are more likely than the U.S. population as a whole to have health insurance. This really makes sense. I mean, farm work is hazardous. There are many occupational injuries. And so people have insurance to protect the farm. They don't want to go bankrupt, don't want to lose that business. Most of the farm families, though, are relying on individual policies. So this comparison is only 5% of Americans rely on individual policies. Half of them are in business offered policies, so in larger group policies, versus 36% of farm owners who are in individual policies. So there really have been few group options available previously. Many people have used a high deductible policy paired with a health savings account. The marketplaces, which are the new name for the exchanges, are going to offer new insurance options that's likely going to lower premiums because it's no longer going to be legal to charge anyone, including farmers and ranchers, for any pre-existing condition or risks associated with the higher risk occupation, such as farming. That seems to be the thing that's most difficult for people to get their head around. I've had some presentations where people have diabetes will say to me, you mean I'm not going to have to pay more because I have diabetes? And I said, no. You mean I'm not going to have to pay more because I'm in a high-risk occupation? No. What's happening in the exchanges is this is a community rating. This is a huge group pooling of risks so that they're smoothing out the cost to everybody. There will be differences based on age, but I'll go into those things more specifically in a bit. So, in order to decrease the number of insured Americans, we have responsibilities on insurance companies, on employers, and on individuals. The insurance companies are de facto being mandated to take all people who are seeking insurance. They can't exclude a consumer who has a pre-existing condition. Now, this is already in place for children under 19, and it will be in place for all of us starting January 1st. They cannot cancel policies for someone being too sick, somebody having too high health care costs. That is already in effect. They can cancel a policy if you don't pay the premiums. There are no more lifetime maximums on the amount that's going to be paid for a list of essential benefits, which I'll show you in a second. That's already in effect. And there's no more annual maximums on the amount paid. And that's going to be in effect starting January 1st. So this is the list of 10 essential benefits. A lot of people will say, well, you know, I don't have kids anymore. Why do I have to worry about pediatric service or maternity and newborn care? In effect, this is the way group policies have always been offered. The benefits are very comprehensive to cover everybody that might be in that risk pool. So that's what these are. You have people who aren't going to need mental health and substance use disorder services or rehabilitative services. But in fact, none of us really know from day to day what our health needs are going to be. A catastrophe can strike us tomorrow. So this is really a fairly comprehensive list of essential health benefits. These are the ones that there can be no annual or lifetime maximums on. Another way to reach this goal is to mandate consumers to purchase insurance. We create a marketplace and exchange where consumers can choose among affordable plans that offer tax credits to some, and it builds on the current employer-employee fringe benefit insurance arrangement by mandating large employers to offer adequate and affordable plans. And it was intended to expand states' Medicaid programs to include all of those under 138% of the federal poverty line, and I've given you examples. It's just under $16,000 for an individual, about $32,500 for a family of 4, and those income levels will change in March of 2014 because that's when the feds come out with the new federal poverty levels. I'll note that there was no arrangements for tax credits for people under 138%, actually under 100% of the federal poverty line, because the law expected those people to be put into the Medicaid programs. So these pay or play rules, the individual mandate is that everyone must have health insurance or pay a federal government penalty. There are going to be certain exceptions, and the employers Including farms and ranches, most offer their workers adequate and affordable insurance if they have 50 or more employees, including seasonal ones, working 30 hours a week for more than 120 days, or they're going to pay a federal government penalty. And I'll show you a little bit more about those details when we talk about farms as businesses. When I talk about affordability, this is not what you and I might think is affordable. This is set in law that says that the annual premium offered by an employer for a self-only plan, not a family plan, has to cost less than 9.5% of a person's annual household gross income. So that's the definition that an employer has to stick to. The other part of that is adequacy. And this is the thing that the actuarials have a lot of fun with. This is an insurance policy that is going to pay at least 60% of the cost in a given year, so that no more than 40% of those costs are expected to be paid by the average person insured in this plan. Many of the plans currently offered are only 50-50 or even less. And a lot of the plans offered in the single market, some people would say aren't really worth the paper they're written on, because once you end up incurring any kind of healthcare expenses, you find out how little the policy really reimburses for. So to give you an example, a 60-40 plan, say I had $2,000 worth of expenses this year, and I would be expected to pay at most out of my pocket $800 of those expenses, and the plan would be expected to pay the balance, the $1,200. That's basically what a 60-40 plan would mean. And they are the bottom kind of plan that's going to be offered. Those are the bronze plans offered in the exchanges. The provisions for consumers about the mandate, this starts January 1st. You must be enrolled in a health insurance plan. Well, the date has really sort of changed. Now it's by March 31st. If you've been paying attention to the media at all, this is kind of a moving target, because healthcare.gov, the website that was used to help people enroll, wasn't functioning very well. They've had to change some of the deadlines. With few exceptions, if you are not insured and your income is over this income limit of 138%, you're going to be required to pay a penalty if you don't get insured. So this is to be insured by March 31st. In this first year in 2014, that penalty is going to be $95 for adults, or 1% of your income, which for most people is going to be a whole lot more than the $95, and you're going to be required to pay whichever is greater. And that is going to go up to a penalty of almost $700 by the year 2016. People don't realize that their children are also mandated to be insured. Now, this is going to be a responsibility both of the parents and actually of the states. All states participate in the state's children's health insurance program. A lot of states do it through their Medicaid program, and these are limits that are more generous. They could be up to 200 or 300% of the federal poverty line for the family income in order for a child to participate. So while the parents may not be eligible for credit and may have to pay for themselves to get insurance, their children may actually be eligible for insurance through the state children's health insurance program. If the children are not insured, the parents will be fined for that. There is a maximum of $285 for a family to be fined. That tax, that fine, that penalty, is going to be assessed at federal income tax time. So it's going to be assessed on your federal income tax return starting in April 2015, when we file our returns for the year 2014. This was the intent, that those of lowest income were going to be enrolled in Medicaid in expansion states. Now, this has only been true for legal residents, and that's actually true for all of the Affordable Care Act, but Medicaid was only for legal residents. Higher income workers are going to get their coverage through Medicare, and those for people age 65 and older, and for those who have some type of a disability, and I'm assuming that some of the participants here might fall into that category or work with people who fall into that category. Know that if people are on Medicare, this really doesn't impact them. The Affordable Care Act is meant for people who were not otherwise insured. It has some changes for Medicare, but not significant ones. It also, higher income workers are expected to get their insurance through large employers, be they farm or off-farm. State health insurance marketplaces, the exchanges, or the private market, which will still exist, with insurance brokers, and sometimes there are health insurance co-ops. The Affordable Care Act is really trying to focus on different ways to make people responsible for their health. So in many cases, you get preventive services for free. They're free at the point of use. Nothing is ever for free, right? Right. So that we're going to pay for them in the premiums up front, but you're not going to have a barrier, a copay, when you go for cancer screenings, vaccinations, blood pressure. All of this list of screenings are supposed to be free at the point of service, and you can go to healthcare.gov/prevention for a full list. The thing that seems to be most popular and most people knew about was that young adults under the age of 26 can now stay on their parents' health plans. This is an example of a 23-year-old kid in Illinois who was able to get a life-saving heart transplant. Now, this is an extreme example, but think about the parents of this young woman. For those of us who have young adult children, we don't forget about our children just because they're over 18 or just because they graduated college. We care about everybody in the family. And so this has really been a way to put a lot of families at ease, to make sure that their young kids could be covered. And most of the time, it's not for catastrophic health needs such as a life-saving heart transplant. It has to do with when kids are in accidents. But in fact, a lot of our children have asthma, have diabetes, and those people care about their kids and care that they're insured. So the marketplace. They could be managed either by the state or the federal government. And there was a lot of confusion here. People thought that, well, if the state didn't choose to have an exchange, then they weren't going to have an exchange at all. Well, that's just not true. The federal government had to spend the time to put together the exchange, and we now see the reasons why that was particularly problematic, because the government had to put together this exchange for over 26 states, and that's what got housed at healthcare.gov, and having to connect to all the different states and all of their different databases was a difficult task. And that's why the healthcare.gov exchange, the online part of it, was working more slowly. So it started October 1st where people could apply. And yes, the online version was pretty rocky to start with. It seems to be working pretty well right now. But people could always enroll over the phone, with a paper application, or in person, because the exchanges existed. The insurance companies gave their proposals, and they were vetted, and they got approved to offer policies in this marketplace. This is the number for the 24-hour call center, 1-800-318-2596. If people are applying online, there's a chat feature. Open enrollment. Some of us are familiar with this term who have enrollment through employment. This is a time period where each year you get to choose which plan you want to be in. This year, we know that it started October 1st, and it's going through December 23rd. That's just been a change. I can't tell you what the dates are going to be next year, but I'll assume it's going to be somewhere between, now they're talking November and December. And November because they're going to be giving the insurance companies a little bit more time to figure out what their experience was and what their premiums might be in the coming year. There have always been qualifying events that allow you to enroll out of that usual schedule. So think about change in family sizes, the birth of a child, there's a marriage, there's a divorce. So people move their jobs. There are reasons that you can enroll out of schedule. Those are called qualifying events. On the exchanges, we have 4 levels of coverage, 4 different metal plans, M-E-T-A-L. The bronze, silver, gold, and platinum. Each has a different value for the level of coverage. The bronze plans are those 60/40 plans. Those are the minimum plans that can be offered there. The silver plans are 70/30, gold 80/20, and platinum 90/10. Any costs not covered by the plans are paid by individuals through deductibles, co-pays, co-insurance. And that is over and above that monthly premium. Now, each plan must cover the same set of minimum essential health benefits. What differs is what additional benefits they may provide and the amount of cost sharing required. So the bronze plan is the least at 60/40, the platinum plan the most at 90/10. They're going to have the highest premium. No health plan can apply a deductible or any cost sharing for those preventive health services that I listed earlier. There's such a thing as these tax credits, and they're a bit confusing, but basically I think about these as a premium discount. And they will vary based on somebody's federal poverty level, where they fit, where their income fits, and it says how much of the premium that family is going to have to pay, and it sets that amount as a maximum of their expenses for, their income for a given year. So let's look at the people at 150% of the federal poverty line. They're going to have to pay at most 4% of their income. So the maximum income for an individual at 150% is, say, $22,000. That means that person is only paying $1,448 in a given year, regardless of what the premiums are actually going to cost for that person of that age. So this is the way the premium discounts are going to work. These are called assistance credits. Basically, what happens when somebody figures out where they're going to fit here, and this is an example of a family of four. If they are less than 138% of the federal poverty line, which for a family of four is $32,499, they first have to find out is, did my state have a Medicaid expansion? And if it did, that person is eligible for Medicaid. But in 26 of the states where they didn't, and you say no, that person between 100% and 138% of the federal poverty line is eligible for a tax credit in the marketplace. Under 100% of the federal poverty line, they're not eligible for a tax credit. And that's unfortunate. But the reality is people at that level probably were not going to be able to afford insurance anyway. They still have other expenses that they need to meet with that very low income. Let's shift over to the middle bar. A family between 138 and 400%, between $32,000 and $94,000, now needs to consider, do they have employer coverage? And is that coverage adequate, 60/40 at least, and affordable? No more than 9.5% of an income for a single plan. And if that answer is yes, that the employer offers that, then that individual is not eligible for a tax credit. But if the answer is no, then that person is eligible for a tax credit. I will suggest to you that the larger businesses will make sure that if they offer coverage, it's going to be adequate or affordable. And the smaller businesses don't have to offer, so this is where you have a lot of people who will be eligible for tax credits. Anybody above that income level, above $94,200 for a family of four, is not eligible for a tax credit. Consumers can always choose employer coverage if it's available, or they can purchase in a private market. But to be eligible for tax credits, consumers must purchase insurance through the marketplace. There are also limits on out-of-pocket costs. Starting in January, there's going to be a limit of $6,350 for an individual, $12,700 for a family. Those are very high numbers, but in fact, there are policies out there now that don't have any upper limits. So setting some upper limit is a good thing. This limit only applies to co-payments and deductibles. This is not the premiums. You're still paying your premium every month. This is how much you're going to have to pay out of pocket at maximum. However, people with incomes below 250% will get subsidies to lower those limits. And this exemption that we're talking about is that for some plans it won't be required to implement this until 2015. And the reason is some employers have prescription drug plans and medical plans for physician services. And it's difficult for those two plans to talk to each other, to figure out that somebody reached their maximum yet. So right now, both of those kinds of plans could have these ridiculously high out-of-pocket maximums. What does this mean for farm owners as employers? If you are sole proprietorship, where you are just the farm owner and you don't have any workers, or the only workers are your family members, then you are considered an individual. You're subject to the individual mandate, and you act just like any other consumer, which is what farmers and ranchers do. You are consumers in that individual market. You can shop for coverage for farmer or your family on the state exchanges or privately. You can compare the cost of your current individual policy, if you have one, to policies available on the state exchanges. And I highly recommend that people do this, even though there's been this whole brouhaha about individual policies being canceled and people were worried about that. The reality is the policies being offered in these exchanges, particularly because of the tax credits offered, are likely going to be very much more affordable for people. So I really think people should compare, even if they have a private plan right now. And then, of course, you get to make your choice. You may like the doctors better that are in your private plan. The American Farm Bureau says the vast majority of farm owners likely won't have to offer insurance because, like other businesses in the U.S., 96% of businesses are exempt because 96% of them are smaller than 50 employees. So anybody that's less than 50 employees does not have to provide insurance. Those small employers, not mandated to offer it to their full-time employees, their employers, their workers, may be mandated to purchase insurance, certainly, and they may likely do so with tax credits in the marketplace. If you offer insurance, it must be offered equally to all of your employees. And right now there's new information coming about the Small Business Health Option Program, the SHOP exchange that's going to be available for small employees. It's in transition. I don't have enough information to give you about it right now. There were some delays in getting that particular exchange up and running, but I have heard that it is going to be in place for this year. If you have less than 25 employees and you do provide health insurance, the government is going to help you, and in fact it could have helped you this year. There was a 35% tax credit in 2014. Basically, they're going to be splitting the cost of this policy for you. And there is the allowment, it's not a word, they're going to allow 90-day waiting periods to get new employees onto your insurance. So let's do an example, a small dairy farm, 10 employees. The total wages at $25,000 per worker is $250,000. The employee health costs at $70,000. A tax credit meant that that $70,000 was going to be helped. You were going to get a premium discount, basically, and the government was going to pay 35%. So they were going to pay $24,500. This year, the government will pay half of those costs. This is a serious incentive to businesses under 25 employees to consider offering insurance, trying to move towards having more businesses be responsible for this. Employers with 50 or more employees had two potential penalties that they would face. These have been delayed until January 2015. The first penalty is if they didn't offer health insurance at all, which was only $2,000 per year for each full-time employee after employee number 31. I do not know who wrote this law or why they figured it out that way, but basically you start paying $2,000 for every employee at number 31. So if you have 60 employees, then you're only paying for 30 of them. It would be a $60,000 per year penalty, and in fact for some people, for some employers, that might be cheaper than buying insurance. And that penalty would increase through the years. The one that most people were worried about was the second one of not providing affordable and adequate health care coverage for any employee with this less than 9.5% of the income being the affordability thing. So if the employer doesn't offer that to you, then they're going to face a penalty if you, as an employee, go to the marketplace and are eligible for a tax credit. So I don't think large employers are going to play this game. They either offer you an adequate and affordable plan or they don't. And if they don't, they're going to end up paying that penalty for health coverage of $2,000 a year. So large employer options that sort of make business sense is to not offer insurance at all and pay a smaller fine, or make sure that it's affordable. The seasonal employee rules, which really will apply to a lot of farms, you need to determine if you average at least 50 full-time employees for 120 days in the prior year. And I think that the look back now may be 14 months. And if you do, then you are required to offer coverage as a large business. So if you're hiring an awful lot of seasonal people, hundreds of seasonal people over a short amount of time, you still may average 50 full-time employees throughout the year, is the way the feds are going to figure this out. And there are calculators that, because you'll be able to see the slide presentation later, where you can go to help you figure out where you are as a large business. The deadlines that are in place, the employer mandate enforcement has been delayed for a year, but all are still subject to this individual mandate. And I've mentioned that that deadline is now, you have to have insurance by March 31st of 2014, and that's because healthcare.gov was not functioning that well. The 6-month enrollment period started October 1st through March 31st. The subsequent enrollment dates we're not sure about. October, December, I'm now hearing November, December. The resource about key dates is at healthcare.gov. Farm workers are a different aspect of this, and this is something that you as a farm owner might need to be thinking about, or you as one of these farm workers need to be thinking about. 85% of seasonal farm workers and their families are uninsured. Only 20% of them used health care services in the prior 2 years. The barriers are cost, language, transportation, no sick leave. These farm workers may have better access, at least, to safety net providers and community health centers because those are being better funded through the Affordable Care Act. There's more money going to train health professionals that will be able to work in these community health centers. So that really may be one of the resources for a lot of these families. They're going to continue to face difficulties in securing health care coverage. Medicaid expansion will only benefit those who are documented. Undocumented will continue to receive emergency coverage only or in these safety net clinics. The large employer mandate will benefit full-time workers who work for a single employer. The marketplaces will benefit documented income-eligible individuals who have subsidized premiums. Some safety net providers are going to actually see increased income, while others may become financially unstable. And it's critical to health reform for us to think about immigration reform. And so people who are thinking about what else needs to be done see how intricately linked these two issues are. If we care about improving access to health care because we care about the health of all of our workers. So the healthcare law highlights the problem with undocumented workers, which has been estimated to be over 50% of farm workers. They're not eligible for Medicaid or the exchanges. The employers don't have to count them, or the hours that you cover them. You don't have to count them in the seasonal employee work. You probably know that. But I guess Extension would like you to consider, if you pay a lot of people, have you violated any laws by hiring them? And you need to be careful about that. And maybe now with this extra look at your place of business, because of the Affordable Care Act, you might need to be differently careful about that. Farm farm families, we recommend that you compare your current insurance, especially those individual policies, with the state exchanges. You can consult with a professional advisor. If your business is close to 50, do you pay the penalty or do you play? Do you offer insurance? You need to develop a plan that optimizes the mandated requirements, and you have a year to do this. You can obtain a health insurance plan if you decide to cover your employees, but you have to make sure that it's adequate, 60/40 plan, and that it costs less than 9.5% of your least paid employees' annual household income. And know that right now there's something called a safe harbor, because you're not likely to know the annual household income of your employee. You only know the wages that you've given that employee, so it has to be 9.5% of their wages. I have some resources that are available to you. Again, you'll be able to see these after. This was a good video on healthcare reform for agricultural producers. It was produced out of Cornell. There are some other websites that I'm giving you here for small businesses, what the penalties are about, what the Affordable Care Act means for agriculture. This is a great all-around cute 9-minute animated video on what the heck the Affordable Care Act is. It's a cute little cartoon. There's some pieces of it that are now inaccurate because it was made probably a year ago. And this is where the Smart Choice health insurance programs that I was talking about are located. It's at the University of Maryland Extension site. So we have a place for the health insurance literacy. We have an Ask an Expert where we answer questions. And then we will be putting up this particular curriculum on what it means for farm families. So it's time now for your comments, your questions, and your experiences. I will let you do both that as well as doing this post-assessment question for you again as a farmer, as a consumer, whether or not you know a little bit more than you did before. So this is the post-assessment. And I'm assuming somebody's going to put that up, and we'll see it in a second.
Yeah, it got covered up, so we will pull it back up here in a second. If you can hang on just a second.
And I'll start taking a look at the questions as they come up in the chat room, and while you're answering this question, and then after the responses are in, if somebody can give them the next question, which is going to be farmers as owners of farms. So you let them answer both of those, and I'm going to start looking at the questions.
Sorry, I got the wrong
What
one.
constitutes emergency? Well, it doesn't matter. I don't care what order they end up answering them in. But I'm not seeing any of their responses on the chart, so I don't have a sense of where people are fitting.
Okay, the first question on the polls we have is related to if you are an employer. So that one is up right now.
Okay. Okay, right. So the assessment is if you're an employer of farm workers, if you know something more. So so that's a little bit of increase because most of them before would know were slight. So now we got slight and moderate. That's good.
Okay, now I will try
let
to
me
pull
start
up the other one.
Questions. Okay. What constitutes emergency coverage? There really is no emergency coverage. What I was referring to is the fact that people who don't have insurance oftentimes will go to community health centers or to emergency rooms, and that's really their only option. I'm not quite sure, so Candy, if you can tell me what you were thinking about emergency coverage might mean, and I might be able to answer that a little better. Yeah, we will be giving you the presentation available. I believe it will be linked at this site, and folks will give that to you afterwards. Yeah, Kathy, thank you.
Other evaluation question now.
Okay, so now this is the evaluation question of, as a consumer, if you have better understanding. Well, that's good. Most people, more people now have at least a moderate, and some of you have a better. Good deal. Great. That's good to know. Gail, in calculating the modified adjusted gross income, yeah, whatever modified adjusted gross income is allowable, so the depreciation should be in there. They gave you two different answers. Okay, well, I have gone through something called a certified application assistance curriculum, and my recollection is that depreciation is allowable. It's whatever shows up on that bottom line of your modified adjusted gross income. So I think that that's the right answer. I'm almost wondering, Paul, if there's going to be a way for me to put other answers that I find out that might be clarifications up so that people who attended this can see my listing of those answers if everything isn't answered fully now, that I have a way to correspond with people. And also, if you have other questions, the links give you my email address, which is rriporte@ksu.edu. Feel free to send me a question, and I'll try to answer it there as well.
Yes, if you have any other comments you want to put up on the website, we can do that also.
Okay, great. Without coverage, go to the emergency room for all services, time, impact. Oh, okay. Yes, the emergency room is the safety net for everybody. And the reason why people are going to be mandated to have insurance is because of that. We all pay for people who don't have insurance. In most states mandate that people have car insurance. It's really the same thing. It's saying that, if you're going to own a car, you have to have insurance. This says if you're going to be a person, you have to have health insurance. Because we all pay, if there was an accident, if there was a car accident, we all pay for people who don't have health insurance. That's why there is a mandate to get more people insured. And people can opt out with the paying a penalty. I think at some point the penalty will get great enough that people will say, well, I'd at least like to have something for my money. So that's why there's an individual mandate. But yes, people will still go to emergency rooms who are uninsured. We're going to try to minimize the amount of people that happens for. Okay? Candy understands that. I'm waiting to see if there are other questions that come up. Again, you can send me questions afterwards if you'd like. I thank you for your time and attention. And now I guess maybe it's back to Paul.
Thanks very much, Roberta, for that excellent information. If we do have some other questions from the chat window, I think Kate is going to be putting those up here. But before we do that, I'd like to do our standard poll questions that we normally do at the end of all of our webinars here. So the first one just asks for your professional affiliation in terms of what type of organization you work with. So it looks like, as expected, we have many from AgrAbility. Thank you for your response on that. The next question asks about the information that was shared. Could you please let us know if you found it to be valuable and if it met your expectations? Okay, thank you for your input on that. Looks like people were well pleased with the content today. The next question asks about the technology that we use today and if you found it to be usable and effective. If you did have any specific issues in terms of being kicked out of the room or other technical problems, We appreciate you entering that into the chat room, and we will try to track that situation down. Looks like everybody did okay today. No major glitches, so we're thankful for that. And then finally, based on today's session, would you attend another session in this series? Speaking of other sessions in the series, our next session is this afternoon at 3 o'clock Eastern Time, and we'll be featuring Michael O'Gorman from the Farmer Veteran Coalition. So we hope that you can join us today. And we're going to be setting up some of the technical aspects for that session right after we finish today. So we're going to kick people out. We're going to have to empty the room so that we can make sure we've got our ducks in a row for that. So shortly after we finish this, you will all be exited. So don't be surprised when that happens. Thank you for your input on that last question. And now I'm going to turn things back over to Roberta. And we've got a few more questions that were in the chat window. And so she can get back on with her camera and microphone and
Okay, I'm back on. I'm going to just start my webcam here in case there are other questions. So, are folks still on? Anybody have other questions that you need of me? I probably would like some other information about what other things people need to know that I didn't cover today. You were kind of split between it met your expectations and strongly agree and agree. So what are the things that you need to know more about, and I might be able to find a way to get that information to you? I've been asked a question about businesses over 50 employees mandated to provide to full-time employees. They don't have to provide insurance to part-time employees, which is why a lot of them are dropping people down under 30 hours a week. Because right now, the law has it that 30 hours a week equals a full-time employee. And that's very different than what the industry would have considered. If there were any way that our Congress could work together, these are the kinds of things that I think would have been worked out. You know, when Medicare originally went into effect, there were a lot of adjustments made to it over the first few years because some things didn't work quite right. This is one that it could be changed to 35 hours a week, but unless our Congress people can talk to each other, we're not going to see any of those kinds of adjustments. So it's only full-time employees right now, and that's 30 hours a week. Guidance on how to people to choose between the plans. Well, there's this Smart Choice curriculum on health insurance literacy, which does talk about how you make a choice. You know, you're kind of playing with the network of providers you have, the benefits that are offered, and the so networks, benefits, and the costs. So people are going to have to decide what's most important to them. For a lot of people, the prescription drug formulary, which lists which prescription drugs are covered and at what cost, is the overriding factor for their choosing which plan they want to go with. To me, the difficult thing is that in a given year, you might know what your needs are right now, you might know what your prescription drugs are right now, but you don't know what's going to happen tomorrow or next week or the week after. And so it's kind of playing a guessing game of which policy is going to be best for you. A lot of people choose it based on the network of providers and how much it's really going to cost them out of pocket. Actually, if they qualify, the question that Gail asks about the silver plan and whether or not you have to qualify for premium assistance. There's two different types of tax credits. One is the tax credit where they're helping you pay for that premium. So that they're paying between 2 and, or you're paying between 2 and 9.5% of your income, and the government is paying the balance. For that kind of a tax credit, it doesn't matter which plan you get. It could be a bronze or it could be a platinum plan. However, if you're at 250% of the federal poverty line or less, and you also want to have the maximum out-of-pocket payments, and you want to have help paying for those out-of-pocket payments, that's the tax subsidy. And that, yes, is only for people who buy at least a silver plan. So the people in the bronze plan, even if they're at 250%, wouldn't be eligible for that maximum. So, okay. You have online where you're going to be able to get the archive of this. And I believe that the PowerPoint presentation will be up there so you can see the links that were in it. It again has my contact information, and feel free to do that. And I'm going to hand the mic back over to Paul. And once again, thank you all for your time and attention.
Thank you, Professor Repertella, for that information. So again, if you have any other questions, feel free to, I'll put her contact information back up on the screen from her presentation. You can always email AgrAbility at agrability.org for questions that might come up. And just a reminder, we'll leave that up for the next probably 10 minutes, but we're going to need to kick you out so we can set up for the next session. So thank you again. We hope to see many of you this afternoon and also tomorrow for our 2 sessions.